Presented by the Common Sense Institute, welcome to Common Sense Digest, the podcast that seeks to inject a little common sense into Iowa's policy discussion. Here's your host, Earl Wright.
Welcome to Common Sense Digest podcast. My name is Earl Wright. I am chairman of the board of Common Sense Institute and your host today. Like other states across the nation, Iowa faces a severe shortage of quality, affordable childcare. Research by the Iowa Women's Foundation found that the annual average cost of infant care in Iowa is 18.4% higher than in-state tuition for a four-year public college and 14.1% higher than annual housing costs. The fact is, child care is prohibitively expensive, if not entirely inaccessible, to many Iowa families with young children. Without affordable and reliable child care, parents, especially mothers, miss out on work. When women forego employment early in their careers because they don't have child care, they lose the opportunity to earn income, may miss out on crucial years to build their careers, and may lose their earning potential over a long period of time. And when their child care reduces participation in Iowa's workforce, the state's businesses and economy also lose. Our guest today is working on innovative solutions to closing the child care gap in her state. CSI's research has found those solutions are working. Sherri Penney serves as Employment Engagement Director for the Iowa Women's Foundation, a Des Moines-based nonprofit focused on shattering the barriers to economic self-sufficiency for Iowa's women and girls. 2 years ago, the foundation brought Sherri on board to engage with Iowa's communities and businesses to identify and implement solutions to the child care shortage. Now the organization is engaged with 85 communities, over 160 business leaders, 44 economic development and Chamber of Commerce offices, and 37 out-of-state leaders, all working on Iowa Women's Foundation on child care solutions. Also joining me today is CSI's own Ben Murray, Director of Policy and Research for CS Iowa. In their latest report, Ben and his team analyzed the outcomes and the economic impacts from one exciting solution pioneered by the Iowa Women's Foundation. Before I go any further, I'm going to ask our guests today to tell me more. Sherri and Ben, thanks for joining me today.
Thanks, Earl.
Yep, thank you for having us.
Before we get to the nuts and bolts of the report, Sherri, take me back to the beginning. Hey, where does this all begin, and how did the Iowa Women's Foundation get involved in the child care issue? And why do we even care about this? What's going on?
Well, thank you. So back in 2012, the Iowa Women's Foundation got together with a group of other leaders, the Iowa Women's Leadership Project. It was a coalition of statewide organizations, and they worked together to put together a report to figure out what are the economic barriers to women and girls' self-sufficiency. That group initially got together and then came up with a report that didn't come out until about 2015, and that was our She Matters report. In that report, we learned that over 70% of Iowa's female heads of household were struggling. 40% were living below the federal poverty level, and another 30% were not making enough to become economically self-sufficient. IWF knew that this was unacceptable, and we sought to understand the underlying factors, really the why behind it. So then in 2016, the Iowa Women's Foundation launched basically a statewide report that said, we need to figure out what are these barriers. We surveyed about 14 communities and found 6 barriers to women's economic self-sufficiency. That statewide tour really kicked off in 2018. And as you know, it takes a while to get across the state. So as we were working with communities to understand these barriers and what was the most influential barrier that we needed to tackle first, we had this thing called a global pandemic in there. And so in 2020, the world came to a screeching halt. We went back to these communities and said, now that the world looks very different, what is the number one barrier to women and girls' economic self-sufficiency? Turns out it was childcare.
I find that interesting. 70% of the head of households, for women or the head of households, were economically challenged. And you got verification of that again in 2020. That's what I hear you saying?
Yep.
Now, a follow-up question to that. Iowa is a strong rural environment with some larger urban areas like Des Moines, Iowa City, and Davenport, et cetera. How much of the challenge for women and girls is in the urban areas versus rural areas, or did you differentiate?
Ooh, that's a great question. So the tour really looked to identify all areas of the state. So we really went from west to east, north to south. In that, we did compare both urban and rural areas. And quite honestly, the findings were about the same across the board. I will say that women in urban areas had access to alleviate some of those burdens much
Okay.
quicker than the rural areas.
Okay, good. So you did your due diligence and you identified this need for childcare through on the ground engagements. What were the steps after that that you took with regards to this information?
So really, we discovered that of those barriers, that childcare was the number one issue that every community identified as being the most important to tackle. So while we have other barriers like housing, transportation, it turns out that these community leaders and specifically these women couldn't necessarily even focus on any other barriers such as housing, transportation, mentorship unless they had childcare. So without childcare, they wouldn't be able to go and find work if they wanted to. They wouldn't be able to go back to school to be able to find the job that they wanted to. So we really understood that childcare is so foundational, and not only just for women, but for these communities, because we had community leaders saying, without childcare open and available in our community, we are not continuing to grow because the first thing any young family is looking for is childcare. Next are going to be your quality schools. So it all goes hand in hand. In order to keep people living and thriving in your community, you have to have access to available quality childcare. And that was really fundamentally by this point in our tour, we were up to 45 communities that we were surveying, and all of them identified childcare as their number one barrier.
Part of previous state studies I've seen on childcare, they have regulatory environment where they say there has to be a certain standard met at the childcare, either the education of the people providing it and the facilities themselves, and so many kids per square foot. Is that something that's occurring in Iowa also, or do you have regulations like that that might impact the availability?
We do, absolutely. And as we continue to get to the root of the issue, it turns out it's a workforce issue. And that is because of some of those regulations that we have in place as a state to really ensure the quality stays at the forefront of childcare. So yes, we have ratios like one adult per four infants, and then it goes up the older the children get. And those regulations are really in place to ensure that we have quality childcare open and available. And so that's something that we continue to push for in our state is keeping those numbers low, those ratio numbers low, because again, we want to see quality stay at the forefront of any sort of sustainable solutions that we're going to lift as a state.
So is there educational requirements that people must have to provide childcare?
Absolutely. The requirements are very similar to what we are finding that your education providers are required to have, meaning your teachers, your paraeducators. So a lot of the same regulations are going to apply for your child care providers because at the end of the day, they are educators. They're not just looked at as child care providers. They're really your children's first teacher from birth all the way through until they get into the school system. So those requirements are the same.
Thank you so much for the introduction. Ben, I want to go to you next. I imagine the specific data on this issue change just about daily. Your child care report has some of the latest data. What does the situation look like today? Does Iowa continue to have a shortage of child care slots? Does the data show this is preventing women from working?
Yeah, no, it's a good question. Like you said, this data is always changing, and the Iowa Women's Foundation's done a lot of great research on this. Sherri went over a lot of that, and that goes back to, at least a decade, right, where we've been looking into this. And what CSI did in this latest report that we've put together is we looked at just, okay, where's the data today on these things? Where do things stand? On the positive side, we found that the childcare shortage has declined by about 8.7% since 2018. So we're making progress. That's a good thing. But when you look at the high level numbers, there's still a shortage, right? We still don't have the slots we need to meet demand. Now, how you look at demand and exactly how many slots are missing, it depends on what assumptions you make, right? Sherri alluded to the fact that, you want to give women access to childcare so that they don't have that barrier. And then she kind of made the note, if they want to enter the workforce, right? And so that's just sort of acknowledging that some people are going to make different decisions, some will want to, and we don't know exactly what every single woman or parent in all of Iowa would do if there weren't obstacles to whatever choices they'd like to make, right? And so what we can do is we can kind of look at the levels and then use some assumptions to figure out what's the range of where the shortage might be. So I'm gonna give you some of those numbers, Earl. Number one is the state has an estimated, and this is as of like October, right? This is updating every day. Actually, the state of Iowa has great resources that update daily, showing you a lot of these statistics. But as of October, when we put together the data on this report, 500,000 children aged 0 through 12 were in the state, and there were 177,000 available operational childcare slots. So that puts you at a shortage of, somewhere around 320,000, right? Now, look, that doesn't mean every single one of those kids needs a slot, every single one of those 320,000, because some of those people, actually, my wife is a good example. My wife stays home with our kids. We have 3 little boys. So there's 3 slots. There's 3 kids right there who don't have a childcare slot, but also don't need one, because my wife wants to be a stay-at-home mom. So we know that the shortage is up to 320,000, but probably something less than that, right? And so then what we did is we looked at a range of assumptions of how many of those kids would need a slot if childcare weren't a barrier, right? So there are many women out there who the only reason why they're not using childcare is because they don't have access or it's not affordable to them or whatever. And so that puts us probably in the range of somewhere close to 118,000 to 242,000. So it's still a big shortage, right? And what does that mean? It means that if it weren't an obstacle at all, if childcare if price weren't an obstacle, if access weren't an obstacle, affordability weren't an obstacle, we estimate that somewhere between 118,000 to 242,000 more slots would be needed. So it's a long-winded way to say, yeah, we still have a shortage. And that's what we're really focused on addressing here.
Iowa has another issue, and it seems to me that this is part of the solution to that issue, and that is a shortage of workers in the state. Am I correct on that, Ben?
Yeah, we have a really tight labor market in Iowa. In fact, the latest data on jobs numbers will come out next week, but Iowa's unemployment rate is something around, it's south of 3%. Our labor force participation rate at the same time has also fallen since pre-COVID. It's never entirely recovered. So you have a falling labor force participation rate and a low unemployment rate, so a very tight labor market. And frankly, it would help the state. It would help the state's businesses a lot if these parents, particularly women, had access to childcare, had access to quality, affordable childcare, and could enter the workforce. It would alleviate that pressure.
Yeah, and I guess the other question I have, and you've done studies on this before, is that shortage of workers, does it match up with the labor force availability of women that would like to go back to work? Could we match up the shortage with what would be available if we had childcare more broadly available? Do you have any idea?
Yeah, so we went into this in our analysis, and when we looked at, how many more women might enter the workforce if childcare weren't an obstacle, right? And the obstacle can look different. We've talked about that. Sometimes the obstacle is access, sometimes it's affordability, something like that. But if just say it weren't an obstacle, we're looking at something around 150,000 additional mothers could enter the workforce if childcare just weren't an obstacle. Now, again, kind of back to the earlier point, let's make that 149,999 because I know my wife, even if childcare weren't an obstacle, she would stay home. So it's kind of that same point. 150 is the maximum, but it's a large number.
Okay. What I was getting at is matching up the skill level of the people with the jobs that were available. But in effect, your argument is that, hey, somehow these people would find jobs and that other folks would have maybe move up in the employment cycle with their skill levels, et cetera. I
mean, I would hope the market would sort of sort out where that labor is needed, right? We haven't done analysis on that level.
But it sounds like there's definitely still work to be done on the issue. Let's talk about solutions. And Sherri, I know you've dedicated yourself to this and continue to take me on this journey of what Iowa Women's Foundation has done to identify lack of child care as an economic barrier for head of households that have women as the head of households. Your organization is engaged with communities across the state and conducted research to better understand the issue. Then you began educating policymakers and business leaders. You got the information and tried to educate them, let them know what was going on. How is this working? What's the solution? And how do you hope that they will help? And what do you think will come out of this?
It's really important to understand that one solution that Iowa has really done is it started by creating my position. So in 2021, the governor assembled a task force of childcare leaders across the state to really understand what is the issue in childcare. And so my position was created, and I'm grant funded by Iowa Economic Development Authority and also the Iowa Department of Health and Human Services. And that really opened the door to a lot of our amazing state leaders and policymakers by showcasing the data that I have and I'm collecting, by creating this technical assistance piece and keeping these communities moving forward on any solution. So in Iowa, we're seeing solutions that tackle a whole wide array of the childcare crisis. Things that are what we keep continuing to find is that childcare is expensive. There isn't necessarily the workforce, back to that staffing issue. There isn't the workforce to create more childcare slots, even if businesses do partner with childcare providers. We found that people that have their children in childcare, that's a personal choice for them as far as where they're receiving that care. And so they don't want their employer to come in and tell them where to send their children in order to receive a benefit from that employer. So we kind of started to think about all these ideas. We have things such as school district partnerships that are happening and schools taking on the child care in very rural communities and using enterprise funds to pay for the staffing of that. Other solutions that we're starting to see are business leaders coming together and forming coalitions to apply for grants if they're looking to build a child care center in a rural community. But more importantly, we needed to continue to look for ways that weren't just going to target individual solutions, but more or less, how do we get a statewide sustainable solution that could be replicated across not even community lines, but potentially state lines? We learned of this community, Hamilton County, Iowa, which is a county of about 10,000 people. And they had lifted this solution on their own in 2021. What it was a public-private solution housed under economic development, where they asked private employers to invest $125 per employee per year into this solution fund to essentially provide operational gap funding. And what they really knew was the local data was showing that they needed to tackle the workforce issue. For example, they had 4 centers sitting at 65% capacity and long wait lists still, figuring out that it was a staffing issue because they didn't have the staff to provide the care and get the children off the list. So they decided to start this solution fund. And now, fast forward to 2023, they were already seeing great success of this public-private solution held under a 501c3 or a 501c6. They started with just a $30,000 investment. And in those 2 years, they saw more and more public and private investments, upwards of $710,000 annually into that fund, because they saw that by increasing provider wages by $2.85 out of this solutions fund, they were able to become fully staffed at all 4 centers. They're at their max licensed capacity, and they still have a long wait list. So now they're in phase 2 because of the success of a solutions fund, where they're now going to have to build or expand their largest county seat childcare center. Because of that, I was able to start to talk about the solution happening in Hamilton County, because this is something that could be replicated, again, across community lines and even state lines. We also had Johnson County launch in March of 2023. These were 2 communities who decided to lift a public-private fund to at least be sustainable and providing that operational gap. At the end of the day, we know that in order to get the childcare workforce to stay and continue providing amazing care, we need to pay them quality, livable wages. In Iowa, it's one of the 3rd lowest paid professions. So the idea was this operational gap funding can be used for many things. Right now, that's a wages issue. We've got to get the providers in the door, professionalizing this career and paying them a livable wage. But down the road, the needs of these funds can change and evolve to something like Hamilton County, where maybe it is an infrastructure build. But the idea was we're able to start to share the solutions happening, and then communities can start to replicate it. And this technical assistance piece is so important because I'm able to provide all of those resources to the communities looking to start. All of these community leaders are willing to share their solutions, share their success. And then we were able to, because we have this data and because I'm grant funded by IEDA and HHS, I am constantly giving that data to our state leaders. And thankfully, we have such innovative state leaders. The Department of Health and Human Services said, we have some funding available. Do you have data showcasing what this could do? And yes, turns out we had communities ready to lift a public-private solutions fund, and the opportunity to have those private funds matched by some state dollars would really propel this into a pilot program. And that's how you start to see the Solutions Fund pilot program taking shape at the end of 2023. And really these communities launched, starting with those reimbursements in January of 2024, all the way through September 30th of 2024. So about 9 months and 10 pilot communities lifted a launch of a Child Care Solutions Fund.
That's fascinating. Let me see if I understand what you've said. Local companies have stepped forward and said, we would like to hire more people. And some of that hiring would be ladies or women that would like to come to work but can't get childcare. And then you match that up with the shortage of childcare. And you found out that the shortage of childcare was not only just a matter of the people not being able to afford it, but also not having the capacity to take it on with skilled staff. So you attack the skilled staff issue by saying, what do we have to pay them to get the people we need? And then and that's going to require, a higher cost for the child care. And then how do we supplement that higher cost for child care with the employers and asking for a certain amount of money, which, it seems pretty reasonable as far as the amount of dollars you talked about. How much was that again in Hamilton County?
$150 per employee per year. That's their entire workforce.
$150 for their entire employee per year. Okay, well, that's okay. And then you said there's also supplemental monies from the state. Well, that $150, I take it, went into the 501c3, so that was tax deductible?
Correct.
Okay. And then the state had funds available through the CSF fund. Is that correct?
These would be through the American Rescue Plan dollars, so
Okay.
ARPA dollars.
Okay. Okay. And then you had Health and Human Services funds that were available. All of this, you kind of said, hey, this is how this is designed. And now you're sharing that information with others and they can kind of design their own program in this public-private partnership. And your organization is doing that.
Correct. We're helping them to supply the resources and assemble the task force and really engage the economic development professionals. And I think that's one thing that's key. Most of these communities, there are the 10 in the pilot communities, they are housing these funds under economic development or a chamber office. And that's how we're really tapping into the business community and asking them to invest. And that cost then doesn't fall to the parents, because the only way to increase the operational cost of a child care center is to increase that tuition. So again, it's all circling back to the idea that if we can help supply the paying livable wages, we're going to attract more workers. Through this work, we saw a study that was put out by the HR Association, and we learned that 52% of women who have left, or childcare providers, who have left the workforce would return with quality wages and benefits. So we knew that it was a workforce issue we had to tackle, and we didn't want that cost to continue to fall to those parents, because again, that's how we get those employers involved. They're aware that if that cost continues to rise, more and more people are going to leave the workforce because it doesn't make sense for them to continue to work and their entire paycheck goes to childcare.
But I can understand that. My wife and I had that conversation when we first got married.
Absolutely.
So it's a family conversation. But, I think what's fascinating to me so far in listening to this is how you've localized the solution. That's kind of exciting. Ben, you did some analysis on this. You must have received some kind of data back from the pilot communities that Sherri has just mentioned. What did they report?
Yeah, so positive, right? I mean, we saw success. That's the short answer. We got reports back from the communities that I would divide into sort of soft reporting and hard reporting, right? So there's actual numbers they reported back, but there's also feedback they gave us in writing. I want to actually start by sharing, we mostly analyzed the hard data side, but I do want to share just a couple of comments from some of these pilot communities to give listeners a sense of what we heard back from those who participated. So I really like what the Howard County director said, who kind of directed this at the local level in Howard County. He said, and this is a quote, "This program allowed us to incentivize the workers to stay with childcare providers and also keep costs low for our families, which then allows them to work for our companies." Right. And you guys did a great job of hitting on this, but a big part of the sustainability of this program for the long term is buy-in. There's an obvious need, not just for the mothers and, potentially fathers as well, but we all understand that mothers are more often affected by this issue, but there's also an interest from the company. Reasonably so. Companies usually want to see evidence that their investment is going to see a real return. They're going to get an ROI, right, if they put money into something. So that's where the state seed money from ARPA really helps. And so you got that state seed money, you're able to prove it out that it's working. And that then entices businesses to go, oh, if I make this investment, it will in fact help resolve these issues with my workforce, right? So there's the kind of full circle. And that quote is great because it just shows that they found that was actually working for them. That whole sort of cycle of, okay, we've got these investment dollars, which helped retain workers, which helped create slots, which then helped businesses alleviate their workforce issues. So that was working. And then Cerro Gordo County reported that providers were, quote, able to seek out better qualified candidates to hire as the pay rate brings in more quality from the hiring pool, and, quote, staff are staying more long-term due to having better pay, which in turn means we're able to take in more children, right? So you see that working the way it's supposed to. The data is, now this is data reported by the pilot communities. And you have to understand, oftentimes reporting can be a little bit imperfect because the question might be, how many staff were impacted? Well, a staff impact might look different. A staff impact could be somebody was given a raise of $2 an hour, or a staff impact could be we were able to hire an entirely new staff person to work at the childcare center, right? but these are the types of numbers that were reported, right? So 105 childcare providers were impacted, were helped in some way, and just over 1,200 childcare workers benefited in some way from the program, okay? The pilots reported creating a total of 275 new childcare slots because of the program, and a total of 373. This is the one that's like really, really encouraging to me, Earl, because it shows that it's working. A total of 373 local businesses and other private entities, not state, not public, private entities, donated or pledged a total of $2.4 million across the 7 reporting pilot communities. So 373 local businesses or private entities pledging $2.4 million across just 7 counties. That's what makes this work.
Fascinating. Sherri, you consulted directly with the pilot program communities throughout. What did you hear from the participants? And it doesn't have to necessarily be financial data, but what did you hear from the participants with regards to their communities and how they thought it was working?
Yeah, I think that very quickly they saw the number of applicants they were starting to get for the child care positions that they had available. In Cerro Gordo County, for example, they were blown away when they advertised for a child care position and had 18 quality applicants apply. That was unheard of for them. They were going sometimes before this pilot program, they would list a position available and they were lucky if they had 1, maybe 2 people apply, and they weren't always even in the child care, didn't have the child care experience that they had. So communities, by paying a higher wage to the workforce, the child care providers started to feel that their community was behind them. They understood the value that they brought. They were professionals in their career, just like our teachers and our educators. And so we knew that this is so important, not only for the morale of childcare providers, but again, for those business leaders. It kept all of the main components that business leaders were finding when they would survey their employees prior to investing in these funds. They were finding that the employees did not want them to take the personal choice out of it. Employers did not want to necessarily go into contract with childcare providers. That's a lot of paperwork, a lot of headaches. And they didn't necessarily want to build an on-site childcare center because it wasn't necessarily going to meet the need of their employees. So at the end of the day, no matter the solutions, and any community that launches a pilot or any community that launches a childcare solutions fund really needs to look at the local data. What are those needs? We can assume that it's probably at least workforce at the beginning, but until you survey your local providers, you won't know exactly what that issue is. And that's the idea of these solution funds. They can mold and grow with these communities. And again, any sort of funding that would come down from state or federal leaders would be in addition to what these communities are already doing for sustainability and a solid foundation moving forward. I always make sure that I'm telling our communities to remember that there's so many systematic changes that we need to be exploring to solve the childcare crisis. But the one thing you can do is continually invest in your local community solutions, because no one is going to care more about your community than the people that are living and working in it. But that also leads us to this idea of, what about large corporations that had a work base across community lines or even across state lines? The good news is that we held a corporate think tank. And because of this report coming out of CSI, we're able to showcase that this does work, this can be replicated. And what if we took this statewide and had a statewide corporate solutions fund where big corporations could invest in a statewide nonprofit, and then in turn, that nonprofit could re-grant out those dollars to the tune of $150 per employee per year based on those corporations' workforces and based on community-led solution funds. So we could then take this on, push those grant dollars out, and it would be a really wonderful way for our state leaders to match those private corporate investments to then be pushed out to communities, and also encourage those communities to say, if we start a childcare solutions fund, we can tap into the corporate grant dollars that Hy-Vee's, Casey's, John Deere's potentially are investing in a statewide solution. And all of that is thanks to this report. This is showing us that there's proof behind this. It's working.
It's exciting. I cannot imagine sitting across from you at a corporate meeting room and saying no. I can't imagine that. CSI has used dynamic economic modeling to forecast the impact of expanding the Childcare Solutions Fund statewide. Ben, what did you find?
In addition to the actual, the reporting directly from the communities, we said let's run our own analysis, right? And that's kind of what you're talking about here. First, what we did is we ran a difference in difference regression in order to get a sense of what it would look like if we expanded this across the entire state. And so we needed to identify, okay, what was the sort of average impact within the pilots, right? And then we used
the difference assumptions. You had a base case that if the world stays as it is, and then if we make the changes we're talking about, what's the incremental impact?
Yep, exactly. So the idea is to try to kind of filter out the difference that would happen anyways without the pilot program and identify what is the difference attributable to the pilot.
Got it.
What we found is you got about 22, I think it was 21.48 new slots for every 1,000 children in that county as a result of the pilot program, which is really interesting because if you just take the numbers reported by the communities themselves, it was about 22 per 1,000. So turns out that the data that was actually reported directly by the pilot communities was very, very close to our analysis using third-party data. So that was good. And so we took that and we said, okay, well, if you get the same, if you were to take this program and make it statewide, well, first of all, we can look at the cost of the program in the communities and how many children were in those communities. And then we can kind of expand that out to the entire state and say, well, how much would this cost to expand to the entire state? And then if you got the same level of impact statewide that you got from the pilots, what would the impact of that be? Does that make sense? Kind of how we arrived at that?
So let me take the first thing you mentioned. Makes total sense. Okay, what's the cost, the incremental cost of doing this? And then what's the incremental benefit of doing it? So what was the cost, and what was your analysis using the econometric models we have as to the economic benefit?
The pilot community spent just under $3 million, which is about what was awarded under ARPA. Let me say this as an aside, because I don't think we've directly touched on this on the cost side, Earl. The state allocated about $3 million from ARPA as sort of a seed money for this. ARPA's not, ARPA money is one-time money, but they said, let's create some seed money. The pilot community spent most of the $3 million. And the idea was that to get the money, they would have to get matches from the private, sector.
Sure,
right. But the money that was spent in the first year was really only that seed money. So all of the money that was raised can be used next year to sustain this program and keep it going, right? So that's important to note. And one reason why this analysis is important to the businesses is because they want to know directly what is their return on investment. And that's what we're going to get to the dynamic stuff. I'm keeping you on the edge of your seat, Earl. But what is the actual ROI if I invest? And so that money is still sitting there. This isn't going to go away. We have that bucket of money from private sector to keep this going. The answer to your question is statewide. So you have $3 million from the pilot programs. Statewide, it would cost $346 million annually. I'm sorry, not annually, over the next 10 years. Yeah, so $350 million over 10 years. And then that gets you GDP growth, so additional GDP that you wouldn't otherwise see of about $13 billion over 10 years for the state of Iowa.
Wait, $13 billion versus $345, a 10-to-1 return?
Yes.
I know, more than that.
It's about
40-to-1 return. My God.
Yeah, I think it was 40. So keep in mind, the idea is that once again, the state would provide seed money. This is the way we ran our model. We said, we don't know if the state will continue to match for 10 years, but let's just assume that the state provides seed money for 1 year. And then the private sector sees the value in it and sustains it for the next 9 years after that. So that's the kind of the assumption we made. It'd be perhaps even better from the private sector's perspective if the state would continue to match. But even if the private sector had to put up all the money for the last 9 years, they would still get $46 of GDP growth returned for every dollar they invest. So that's a huge ROI.
Okay, I'm going to put you on the edge of your seat. If I'm a company contributing my $150 per person, what ROI are you suggesting that I might do, or has the econometric model looked at that, and that's something you can calculate in the future?
we haven't looked at it at that granular of a level. I mean, I don't have access to the balance sheets of every company that's doing this, right? So all I can really do is look at the macro level, and that's what we're doing.
So what you've in effect telling us as podcast listeners is that the general population of Iowa has 40 times return in their GDP versus every dollar that's been spent to improve the program. So the community as a whole of Iowa is significantly enhanced by what's being suggested in the pilot programs that Sherri's talking about. Do I have that right?
That's right. And so GDP largely captures like the overall benefit to Iowa's economy. Yeah. So it's true that a lot of that benefit isn't going back directly to the businesses.
Iowa. They're getting the benefit of it, and the general population is getting the benefit of it. So it's a win-win for everybody. How much each company gets is a win. That's their unique situation, but still, it's a massive benefit to the state. And what's holding us back and getting this implemented, Sherri?
Quite honestly, really just unveiling this report. I think that now that this report is out there, it's circulating in the public, this is going to be my absolute leg to stand on and say, this can work, and here's the proof. So I'm excited because of this report to see what we prioritize as a state moving forward when it comes to childcare.
That's fantastic. And besides that, it looks like the state could end up having 150-some thousand or more people added to the workforce. And we know you've got a tough situation in Iowa. Sounds very, very exciting. I hope the impact, well, you know what? I know the impact will be what you're talking about. All we need to do is get you and Ben in front of people. And Ben, you give her the support. Make certain she's got all the support she needs. And Sherri, go for it. Thank you both so much for your time today and explaining the study and CSI's relevance in helping you move a very important issue forward. Ben, Sherri, thank you so much.
Thank you.
Thanks, Earl.
Thank you for listening to the Common Sense Digest. For more on today's topic, as well as our research on the most pressing public policy issues facing Iowa, please visit commonsenseinstituteus.org/Iowa. The preceding episode, along with all others, is available on podcatchers everywhere or on our website under the podcast tab. Our technical producer is John Ekstrom and Deft Communications. This has been a production of the Common Sense Institute.